In this podcast episode, Brigham Buhler, a former pharmaceutical representative and healthcare entrepreneur, delves into the intricate and often troubling landscape of the American healthcare system. He discusses the systemic issues that contribute to the high rates of bankruptcy due to healthcare costs, the role of corporate interests, and the urgent need for reform. Buhler asserts that healthcare costs are the leading cause of bankruptcy in America, a situation that has evolved over decades. He emphasizes the importance of understanding the root causes of chronic diseases, which he attributes to poor diet, lifestyle choices, and the quality of food available in the U.S. He highlights the alarming increase in approved food ingredients in America, from 700 in the 1980s to over 10,000 today, compared to Europe, which has maintained stricter regulations. This proliferation of additives and contaminants in food contributes to the rising rates of chronic illnesses. A significant portion of Buhler's critique focuses on the corporate capture of healthcare, particularly by insurance companies and pharmaceutical firms. He explains how primary care physicians are often constrained by insurance companies, which dictate the terms of patient care. With an average of just 6 minutes per patient, doctors are unable to provide comprehensive care, leading to a system that prioritizes profits over patient health. Buhler argues that the entire healthcare incentive structure is designed to monetize chronic disease rather than promote health and wellness. He points out that the 5 largest insurance companies made 4 times the revenue of the top 5 pharmaceutical companies, illustrating the immense power and influence of these entities. This corporate dominance leads to a healthcare system that is more focused on quarterly profits than on improving patient outcomes. Buhler discusses the complicity of regulatory bodies like the FDA, NIH, and CDC in perpetuating the problems within the healthcare system. He notes that many leaders within these organizations have transitioned to lucrative positions in the pharmaceutical industry, creating a conflict of interest that undermines public trust. He emphasizes that the FDA's approval process often lacks rigorous safety studies, particularly for medical devices and drugs, which can lead to dangerous outcomes for patients. The opioid crisis serves as a poignant example of the failures within the healthcare system. Buhler recounts how pharmaceutical companies aggressively marketed opioids, leading to widespread addiction and death. He highlights the role of pharmacy benefit managers, PBMs, in this crisis, explaining how they profit from the overprescription of medications. The systemic issues surrounding opioids have resulted in a public health emergency, with many individuals turning to dangerous alternatives when access to prescribed medications is restricted. Despite the grim realities of the current system, Buhler remains optimistic about the potential for change. He advocates for a shift towards proactive and predictive healthcare, emphasizing the importance of early intervention and preventive measures. He believes that advancements in technology, such as AI and algorithm-based medicine, can revolutionize patient care by providing real-time data and personalized health insights. Buhler encourages individuals to take control of their health by seeking out cash-pay clinics that prioritize preventive care over insurance-based models. He stresses the importance of regular blood work and health assessments to catch potential issues before they escalate into chronic diseases. By empowering patients to advocate for their own health, Buhler believes that the tide can be turned against the current system. Throughout the discussion, Buhler underscores the significance of community and support in achieving better health outcomes. He argues that the isolation many individuals feel in their health journeys can be mitigated through shared experiences and collective efforts. By fostering a sense of community, individuals can motivate each other to make healthier choices and hold one another accountable.